Hi everyone, my name is Liz. Welcome back to the Early Date Coaching channel. In today's video, we'll be looking at the essentials of hand hygiene as it applies to your OSCE exams. These aspects may seem insignificant to you when it comes to OSCE, but it's essential. That's why at different points in time, the assessor will be checking if you are actually observing your hand hygiene. Hand hygiene is expected to be applied at different points in time in different stations of the OSCE. This video is just going to talk about the 5 moments of hand hygiene and how it applies to OSCE exams. We will also look at the different hand hygiene techniques that applies to OSCE exams. The 5 moments of hand hygiene stated by the World Health Organization includes the following. First, before contacting the patient. Before you approach the patient at any point in time in your OSCE exams, you are expected to perform hand hygiene. The first contact you have with your patient during the OSCE exams is the one that you meet the patient to introduce yourself and also get to know your patient. Before that contact, you are expected to perform an hand hygiene. At other times, during the procedure, there are times you leave and come back to meet your patients. Let's take, for instance, you left the patient to go and prepare the equipment, and when you are back, you're expected to perform another hand hygiene. The reason why you perform hand hygiene before contacting your patient is because patient safety is key when it comes to nursing care, and that's why those moments of hand hygiene are essential in OSCE. The second moment of hand hygiene is before clean and aseptic procedure. In OSCE, the different procedures carried out can be classified as clean or aseptic, regardless of the one you're doing. Look at the marking criteria very well. You see that it's expected of you to perform hand hygiene from time to time. A very good example of this is the wound dressing procedure. There are specific times during the wound dressing procedure that you're expected to perform hand hygiene. You need to look at your marking criteria very well to observe this moment. The third moment I'll be talking about is after body fluid exposure risk. During some OSCE procedures, there is tendency for your hands to get contaminated due to the exposure risk to patient body fluids. Such procedures include IV flush, a urine sample collection, blood glucose monitoring. During these procedures, you discover that there is tendency for your hands to get contaminated with the body fluids of the patient. So that's why you even make use of your hand gloves. So it's essential that after you've taken off your hand gloves, you perform hand hygiene. This prevents the risk of infecting yourself and other patients or the environment with any harmful germs in your hands. The fourth moment of hand hygiene is after contact with the patient. During the OSCE, there are times that you contact the patient to leave the patient and you still come back. So that point you leave the patient, you're expected to perform hand hygiene. For example, you've met the patient, established contact, and explained the reason why you've come to meet the patient. Now you want to leave the patient to get the equipment required for the procedure to be performed. You are expected to perform hand hygiene after you've left the patient. Also, when you come back, perform the procedure, and you're about leaving the patient, you are expected to perform hand hygiene before leaving the patient. The last moment of hand hygiene is after you've left the patient surrounding. You're done with the procedure and you're about leaving the patient surrounding. You're expected to perform another hand hygiene. The reason is because while you encounter with the patient, there's tendency that you've touched different places around the patient. So in order not to transfer harmful germs from your hands to other patients or to yourself, perform hand hygiene immediately you leave the patient's surroundings.